Thank you very much again for participating this panel discussion. And thanks to our dear Mr. Presidents joining us for this discussion. As we know, particularly the umbrella organizations work together. Work together just to struggle against the current COVID-19 pandemic. And this causes one of the greatest challenges that humanity and healthcare professionals have ever faced in recent decades. So Turkish Medical Association has promptly claimed responsibility for the pandemic in Turkey from the very beginning and urged the government to act transparently, to enlighten the public, and seek for cooperation with Ministry of Health without much result, unfortunately. We have to remind that the World Medical Association had a resolution in 2020, Cordoba General Assembly, where already indicated that medical associations should urge governments to include health system strengthening and resilience as part of national COVID recovery plans. However, this approach by Turkish Medical Association is not well received by Turkish government as expected, and led Turkish governmental announcements to dismantle the Turkish Medical Association. And allegedly, this was to protect patients and the profession from terrorists. Turkish Medical Association has always been recognized for its commitment to serve public health interests, to protect patients and physicians with respect of the ethical values of the profession. And qualifying the Turkish Medical Association as a terrorist constitutes a grave defamation and an insult to the entire profession, unfortunately. And a part of this defamation, criminalization, we had an atrocity that our high disciplinary committee member and former member of the Central Council of Turkish Medical Association was detained on November 20th and arrested by the court afterwards. The court had stated two justifications for the arrest of Dr. Gökalp. The first one is Dr. Gökalp's participation in a meeting of a platform when the government had no claim as to its illegality, and to which Dr. Gökalp actually insistently refused claims about his presence there. And there were no concrete evidence about this participation. The second is a false statement made by a confessor, or it's better to maybe mention that it's a false witness, who gave herself in 2016 and testified against many others. And there were no testimonies against Dr. Gökalp before, but 3 years after the first testimonies, the false testimonies, in 2019, she started testifying against many physicians, including Dr. Gökalp. And it was clear that the official documents were evidence he never worked together with this person and not acquainted because the person is a health worker, but they didn't work together. So it was her slanderous accusations without any ground were considered as evidence against the stance of the Court of Cassation, Constitutional Court, and the European Court of Human Rights, that statements made by confessors have no value as evidence. As a dignified physician upholding good medical ethics, Dr. Gökalp has his professional career that cannot be stained by slanders of perjurers and hollow claims. So we tried to explain the situation, and now he has a court hearing on 10th of February. So we decided to discuss the situation about these accusations, the criminalization of Turkish Medical Association. And we have to know that this is a kind of targeting by the government, because Turkish Medical Association has urged the government to be transparent about the pandemic, to take scientific steps to prevent this pandemic to be disseminated. So it wasn't well received, as I have told about. And it is maybe will be helpful to discuss the independence of medical associations, national medical associations, regarding to prevent pandemics, regarding to protect public health in this case. And also the professional autonomy, the medical autonomy, professions autonomy in regard with all these healthcare, public healthcare particularly. And we work together with our umbrella organizations, as I have mentioned in the beginning. And now we have two speakers, our presidents from World Medical Association, WMA and CPME. So we are grateful to our colleagues to be together with us and to share their opinion on the independence of medical associations. I would like to give the floor to the World Medical Association's president, Dr. Barb. We are honored to be together with you and to hear what you would just discuss with us. Thank you, Dr. Barb.
Thank you very much for inviting us to participate in this discussion today. I want to say on behalf of the World Medical Association that we are very proud of what the Turkish Medical Association is doing, that you are standing up for one of your prominent members, and that you are standing up as an association to speak out around these issues, both those around the allegations of Dr. Gökalp, as well as around management of the coronavirus pandemic. You know from our previous discussions and from the two letters and the resolution that WMA passed that we are in solidarity with you. We very much support the principles that you are pursuing to defend the member of your previous executive council. We believe from what we have been told that these are unfair and unjust accusations against your individual member. And we believe that as an association, you should have a voice and a responsibility to defend him, if you will. We, the World Medical Association, has a very strong policy statement on the independence of national medical associations. I assume that most of you on this meeting today have seen that, but I will read just one or two short pieces of that. In referring to national medical associations, it says, these associations may also campaign or advocate on behalf of their members, often in the field of public health. Such advocacy is not always welcomed by governments, who may consider the advocacy to have oppositional politics attached, when in reality, It is based upon an understanding of the medical evidence and the needs of patients and populations. Your situation is particularly difficult because it involves several levels or layers. It involves the individual actions of Dr. Gökalp and others that must be defended, but now it also involves the defense of your National Medical Association. And while those are obviously related, they are separate, and each needs to be defended as much as we can. The last thing I will say, and then I will turn it over to Dr. Montgomery, is that we, the World Medical Association, just last Sunday received a very prestigious international award called the Golden Arrow. And it was the first time that a medical association or any other organization has received this award. All previous winners have been individuals. This award was given to the World Medical Association very specifically because of the actions of doctors around the world to advocate for protecting patients during the pandemic, for advocating for adequate personal protective equipment, adequate hospital facilities, and adequate care for those suffering from COVID, and for the personal risks that physicians around the world have taken in running toward this pandemic and caring for those patients, even when it placed them at great personal danger. So the work of a medical association like the Turkish Medical Association to advocate on behalf of their patients, their physician colleagues, and their society is very well received and appreciated around the world. And we are sad that your government does not appreciate the work that you have done and the risk that you have taken in advocating for better care and facilities during this coronavirus pandemic. So I compliment you for what you are doing. We stand to support you in any reasonable way that we can. Thank you.
Thank you very much. And congratulations to World Medical Association. We are all proud of our umbrella organization, World Medical Association, for raising awareness and just their stance during this pandemic. It is invaluable indeed to struggle against the pandemic and all these public health care issues together with our organization. And again, another umbrella organization, the Standing Committee of European Doctors, CPME President, our dear Mr. President, Dr. Frank Ulrich Montgomery. We are also grateful to be together with you, and we know how dedicated you work in German Medical Association as well as CPME. So the floor is yours.
Thank you very much, Sebnem. Thank you for the kind invitation. And I can continue almost seamlessly on the point where David, my friend from WMA, left off. First of all, I would like to commend the Turkish Medical Association for the work you're doing. It is absolutely necessary that the voice of physicians in your country is heard, and not only heard in your country, but also abroad. It is absolutely important that you inform the public and the people in your country and abroad on the situation, the democratic situation, the organizational situation, but of course, in present times, also in the pandemic situation. You know, we've had several occasions in the past when either WMA or CPME came to Turkey, to Ankara, to Diyarbakir, or to Istanbul to observe some of the trials which were held before criminal courts in Turkey. And we always admired your courage and the intensity of your fight, coming ourselves from a position of great freedom and great liberty, and the most important liberty of all, that is the liberty to speak freely and say what you want to say. So this is why, wouldn't there be a pandemic, I'm pretty sure either David from WMA or me from CPME would have either been there representing our organizations at the trial in the court, or would send someone from our organizations who could keep a close eye on what is going on there. But to take this on a slightly broader level, what is our big conviction and what joins all of us together? That is the deep conviction that professional autonomy and clinical independence are essential elements in providing healthcare to all patients and populations. And these professional autonomy and clinical independence, they are a sign of quality assurance and of a quality delivery of healthcare services to our populations. But they have to be organized, and they have to be organized in independent professional bodies, be it medical organizations, be it the organizations of other professions as well. I mean, we do believe that our co-workers, nurses, etc., should also have similar organizations to defend the special quality of their profession. And we have three most important sides which we have to consider and which we have to deliver to. One of them is the general public. We are in these organizations a guarantee for high standards of medicine and of course for the ethical provision of medical services by doctors. The population always has to know that their doctors are performing with a view of the individual patient and not with a view to greater political or other convictions. The second is that in the community of doctors, of course, we have to establish our own rules. There has to be an ethical code. There has to be a deontological regulation that regulates the way doctors perform their duties. And of course, this has to be represented democratically. And democratically means we have to have organizations with a strong background of elections, of democratic structures behind the organization. And of course, that is where the third party, which we also always have to consider, the governments, that is what they aim at. If they do not want to have the professional representation of doctors, they do not aim at the structure, they aim at individuals, at persons, and they are trying to, well, you could say them to boil them down, to cook them softly in order to make it, to discriminate the professional organization that is behind them. So we always have to keep in mind the three sides. Our work is directed to general public. Our work is directed to our own community of physicians by giving us rules and regulations. And of course, it is directed towards government. And we can only urge all governments of this world to cooperate with the medical organizations. We have the special knowledge of medicine, not politicians. We are the people who are exerting this work. We are the people who are treating patients. And therefore, in quality, high standard services, equality, high standard countries where healthcare is administered at a high quality, that is where strong medical organizations exist. And therefore, without taking this too much lengths now. We could, of course, indulge now in the development of professional codes or the regulation of education, which we are all responsible for. We can only conclude that the existence of strong physicians' organizations is one of the backbones of a good healthcare service of a country. This is what I would like to discuss with you, and this is where we would like to support the Turkish Medical Association by all means. Thank you.
Dear Mr. President, we thank you for these strong words, actually. And we know that our umbrella organizations have always been in solidarity with Turkish Medical Association. And we have to know that during this pandemic, public opinion had been very clear, and the reliability of Turkish Medical Association has dramatically increased while the government's reliability had dropped. So it is important for us to keep our stance, to tell the truth, to share all the information with the public so that they can decide on their own behalves and keep themselves healthy. So thank you very much for just supporting the independence of professional organizations and supporting the autonomy of medical profession. We need these organizations to be on the safe side and to be strong. We know that Şeyhmus Gökalp is one of the physicians in Turkey who had struggled for public health, to protect public health, and he had been in a position where, of course, he had never compromised on ethical values while taking his firm stance against anti-democratic practices as well. What he is facing presently is nothing less than sheer anti-democracy, injustice, unjustness, and irresponsibility. And this is strictly a part of targeting and criminalizing Turkish Medical Association. But we are sure that we will just manage to struggle and keep the public health in the first instance. By the way, I can't see any questions on the chat, but if you would like to just take the floor, because we know that members of European Union delegation are together with us, thanks to them for joining. And we have colleagues. Our Secretary General of World Medical Association is with us. And we understand that there are several messages of congratulations for your presentations, our dear Mr. Presidents. And, but we don't have any questions. So everything is clear, I think, on the side of professional organization independence. But if you want to add a few words, the floor is yours.
David, yes, your turn.
Yes, please. Mrs. Pasakitu, I hope I could pronounce correctly. Sorry.
It's a very difficult surname. Thank you very much. On behalf of the Greek Medical Association, the Pan-Hellenic Medical Association, as a representative, and because we are neighbors and we have very strong feelings with the Turkish population, no matter what happens with the governments, it's completely opposite for the feelings that we have for the Turkish population. I would like to express on behalf of our National Medical Association our strong support to the Turkish Medical Association. And of course, we are at your side, and we would like to help you And I also would like to notice that the Turk doctors made a great job in the south borders of your country with the refugee problem. As a chairperson in the working group on the refugee health, I would like to express my gratitude, and I would like to thank doctors, Turkish doctors, who supported those vulnerable groups of the refugees who came in the borders of the south borders of Turkey. Thank you very much, and we cordially support you.
Thank you very much for your nice supportive words, and I promise to convey all your nice words to Dr. Gökalp also on 10th of February. I'm sure he will feel so strong in this case, and we have supportive messages also on the chat. Anybody to take the floor, or?
Jacques, did you want to speak?
Yes, please. The floor is yours, Dr. Barb.
I will give my parting comments, but I thought perhaps Jacques de Haller also wanted to comment. You know, each country's situation is somewhat different. The challenges you face with your legal system there and with your government are different than in Western Europe, different than in the Western Hemisphere. We count on you to find the best path forward to advocate for your members and for your association. We can encourage you. We can help you find what has been written that supports your position. Many policies and statements of the WMA are very strong. One that I read, one's on criminalization of medical practice, some of which apply to this. The Declaration of Madrid applies to this. And even some of the statements around the conduct of medical practice during times of armed conflict somewhat apply in these situations. So again, I hope we have helped you, encourage you and strengthen you, and have provided some information that you can use as you work through this very challenging situation. Thank you.
Thank you, Dr. Barb. It is very important indeed to remind all the World Medical Association policies where we feel safe with all the backbones of policies together with us. And dear Dr. Montgomery, would you like to have your remarks?
I have seen that my predecessor, Jacques de Haller from Switzerland, has raised his hand, and I think he would like to say something. And so I think it might be a little bit early for closing remarks. And okay. I know that Jacques has been representing us in Turkey in the past in several court proceedings. So maybe he would like to add a few words, and then I will round up from the perspective of CPME. Sorry for taking over the lead and the directory of this, but Sebnem, if you don't mind, let's ask Jacques de Haller what he has to say. Jacques.
Yeah, thank you, Monty, and thanks, David, for inviting me to speak. I can only repeat and strongly repeat the commitment of your European colleagues to support the Turkish Medical Association. As I've said in Ankara a couple of times in the past years, I would love to be there with you, not because you go to court, but because it's so important what you're doing, what you are testifying, the way you represent the medical ethics and how you do it. I mean, it's really an example for all of us. It's a terrible reminder that it can happen to all of us, all of our associations. And this is a message we should take home from today, as in the past years. It's something we must be aware of. We must be ready to defend medical ethics, our autonomy, and the quality of our work, and our readiness to help and support any patient in need of our of medical care. That's what I wanted to stress tonight, and tell you again how warmly I think of all of you and of the past committee of the Turkish Medical Association, which is still in a judicial process. It's good to know you're supporting medical ethics as you're doing, and I'm quite thankful for that. Thank you.
Thank you very much, Dr. De Haller. And please excuse me for not noticing your hand raised on the screen. And thanks to Monty for reminding me the raised hand. We all know how you have always been in Turkey whenever there were discussions about Turkish Medical Association and our colleagues. One of the previous executive board members have immediately been arrested one morning, and we have always heartfelt the support of World Medical Association and our umbrella organizations. Thank you very much. Now we have another raised hand. Before you remind me, Monty, that Mary McCarthy also asks for the floor. The floor is yours, please.
Thank you. I speak on behalf of UEMO, which is the European Union of General Practitioners, a body of which Turkey is a member. And we stand with other European medical organizations in support of the Turkish Medical Association and of all its members. It's just to say that we stand together. We are all doctors without borders. We stand in solidarity. Thank you.
We thank you for the support, and you have to know that this support is all heartfelt indeed. For Dr. Gökalp's case and for Turkish Medical Association. I can't see any more raised hands. And any questions? And we thank European Union delegation to Turkey for following the presentation, and also a decision to follow the court case of Dr. Şeyhmus Gökalp. Sorry, we are all together, and we know that the European Union delegation always closely follows the situation. So there are no other raised hands. Then I can give the floor to you, Dr. Montgomery.
Well, thank you very much. Obviously, David, Mary, and I have been, and Jacques have been so clear that there are no questions, which is good because we were able to transmit our solidarity, which is so important for you. And we stand by your side, and we will do so in the future. You know that you can rely on us and call on us whenever that is necessary. We believe in the principle of strong professional organizations. We know you are a strong professional organization, and you are flying the flag of medical liberty and of professional independence. That is important, and we thank you for doing this because your situation to do this is so much more difficult. It is so much easier for us, and therefore we admire you for the work you are doing. Thank you very much. And from my part, my side, this would conclude my presentation. Maybe David has to say a few final words. No, he says no. So it is your turn to round up, Sebnem, now.
Actually, before rounding up, there is a kind of remark and a way of question from a journalist, if you would like to say a few words. It is today with the pandemic, we have seen that all borders are not very important for the disease. As the Physicians Association, we see that you act together and in solidarity. Is there any attempt of WMA and CPME on their any experienced undemocratic situations in Turkey? But this is not a question actually, because you have already clearly indicated how you just approach to the situation in Turkey by supporting Turkish Medical Association. But if you want to say a few words.
Yes, I just want to say one experience, which we have experienced in several countries. It were the physicians who were warning of the dangerous position with the pandemic. And it was very often strong politicians who denied the existence of the virus, who denied the international trans-border existence of this virus. And therefore, I think we in the medical profession, we should keep up our ties, we should talk to each other, and we should make the public aware of the dangers of this pandemic. And we all know this is not going to be the last pandemic, and there are going to be more and more, and the world needs our professional competence. And this is something they need in Turkey, they need in Germany, they need in the US, and wherever we are, they need it in Myanmar actually very much just now. And so we stand together for democratic principles, for strong medical organizations. This is our firm belief, and that is what David and I have fought all their lives for. Thank you very much. And thank you for holding this meeting, Sebnem.
Thank you very much indeed. We also have a participant from German Embassy. Thank you for joining us. And thanks to our speakers, Mr. Presidents, to clearly explain the situation and the importance of independence of medical associations and professional organizations, and all the speakers who had taken the floor and just raised their awareness and raised their ideas, shared the ideas together with us. It is always very important to convey this situation to our colleague, Dr. Gökalp, because we know that he has always acted as one of the members of Turkish Medical Association, volunteers of Turkish Medical Association working hard for public health. We all thank you for joining us, and we thank our colleagues from WMA and CPME for organizing this panel discussion, the online panel discussion, and bringing us together. Thank you very much.